serving and empowering nurses. This is Nurse Connect with Kristine.
Hello again, podcast viewers, and it's very exciting today because we've got Selby Li. Hi, Selby. How are you? That's good. That's good to hear. I'm so excited to interview Selby because she's one of our nurses who passed the OSCE at AURN pathway, and we're so grateful for you. And I'm sure it's going to be very informative today and insightful for the nurses that are wanting to work in an ICU environment. Okay, and so I hope you stay tuned for the rest of the interview. So then Selby is going to give you an information, okay, and tips in working as an RN in ICU here in Australia, okay. And so we've got Selby. She's a mom of two, isn't it? Beautiful kids. And she's a busy mom, but look, she's prioritized, to get her registration. And I'm so proud of Selby. She's nurse. She's a registered nurse from Taiwan. And after when she came to Australia, she then continued her pathway, right, to becoming a registered nurse in Australia. And she now works in one of the biggest hospital in Melbourne, okay, as an ICU nurse. I'm so proud of Selby. I remember her when she was enrolled at AURN pathway. I mentored her. She's very respectful, she's very kind. And I thought, oh, Selby, she's a really great nurse, okay. And I remember telling her, Selby, you're gonna be a really great nurse, okay. And I'm sure you are at this time as well, helping our our Australian community, right? So thank you for the work that you do, Selby, okay. Now look, we have a few I just wanted to say all the nurses today is very lucky, okay, to hear from Selby as she walk us through that experience, okay. And so let's dive into the question, Selby, okay, before I talk more. So the first question to Selby is, are you currently enjoying your work so far in ICU, and why? And what are the areas of nursing did you work before or overseas? And are you able to compare it, Selby, the difference?
Okay. So before I starting working in Australia, I used to work in ICU in Taiwan. So I have a ICU experience already. So after I get my registration, so I applied to two hospital job. So one is like a respiratory ward, and the other one is cardiac, because that's the my interest in those patients. So after 1 year as ward nurse, I want to go back to work in ICU. So I apply. We have the program called post-graduation program, which is like after the bachelor. So it's a post-graduation, like you have a further study. So it's like a hospital support you to study as well as that you work in the ICU and then practice your skills and knowledge as well. So I'm quite enjoying this working in the ICU at the moment, because it's very it's my specialty. Yeah, it's my specialty. It's my area to work to, and then everyone is very supportive. The manager is supportive. Like when you study, they are very willing to teach you. It's not like in my country they are quite mean sometimes. Like there was, you need to Google yourself. You need to go home and study by yourself. It's not like this teaching hospital. So our seniors is kind of teaching us, and we learn a more deeper knowledge than in the ward as well. And
that's correct.
Compared to obviously I'm just talking about my country because I don't know other countries. In Australia, in ICU, we have 1-on-1 ratio. So one patient for one nurse. Yeah, but in my country in Taiwan, it's like a one nurse to two patients. So you feel like the workload is much less compared to Taiwan, and you like a severity. I wouldn't say here is more severe or Taiwan is more severe. Pretty much the same thing, and the knowledge and the skills probably much the same thing, but the machine itself, probably for example, dialysis machine is different. So and new technologies, so you need to relearn all that stuff, and every hospital's protocol is different as well. So for example, in here, if we're gonna take blood culture, we need to do a dressing pack, sterile, and all that stuff techniques. But in Taiwan, we just take like a blood test. So it's quite different. The way they do things is quite different as well.
Yeah. Wow, I love it, Selby, and I love that you've identified the differences there. And in the Philippines is worse, right? Sometimes in ICU you get 1:4, 1:3, But because it's kind of laid back in Australia. I love it. I did look after university nurses doing their training also in ICU, and I usually visit them. It's definitely 1:1. Okay, and so that's very strictly followed. So so there you go. And I'm very happy that you're enjoying your ICU work, Selby. I think of all the the ward or the specialty care ward that I've been to and looked after university nurses, ICU is one of the best area to work as an RN. Okay, so you're very lucky. Now, so the next question is, how would you describe working in an ICU department in Australia? And how's the workload? And I think you've already tackled this. So in terms of workload, everyone, for those who are aspiring to be a ICU nurse in Australia, there you go. It's 1:1 because we're so focused on our patients in Australia. Okay, so all the care that needed to be given, it has to be focused. And so, are you able to describe the listeners here and those who are watching Selby? Are you able to describe the your shift? Okay, working in an ICU. So you could give them an example. Morning shift or after. It's up to you, Selby.
Yeah. So in our hospital we have two different kind of shifts. You can choose you want to do 8 hours or 12 hours. So 12 hours is like a morning, PM, and a night shifts, and 12 hours is like a 7 to 7. So it depends what suits you better. So currently, because I'm studying, so I mostly do 8-hour shifts. So I start my shifts like we will have a huddle first, so the ANUMs, like managers, will talk about what's happening, what's been happening, and what area we need to be focused on today. And then after the huddle, we go to the handover. So it's one-on-one handover. You only have one patient. You really focus on what's the patient's goal, what's the patient's care, any care plan need to be achieved today, what's the plan for today. So after the handover, we kind of start planning your shifts, like at first what you're gonna do, and of course you have to check the environment first, safety check. Of course, that's the first thing you have to do in your work. Every shift the same, like you have the any emergency equipment at the bedside, is oxygen working, the suction is connecting right, and make sure all the monitor equipment is working before you start the shifts. And after checking all that safety checks, you start introduce yourself, talk to the patients, do a head-to-toe assessment before you give medications. So head-to-toe assessment, and then medications, and then will be probably like a walk round. The doctor will ask you, what's your concerns, and nursing opinions, like what can they do for the patients, or like we will discuss as a group, like what's the goals of the patient for today, and we kind of work together. Yeah, pretty much that's it. That's the start of the shifts after medication. Because I think the big difference is Australia, they don't have very restrict visiting hours. For example, in my country, we only have a visiting hours, half an hour in the morning, half an hour at night for the ICU patient. But here, you can come anytime you want. You can come in and go out like during the day, during the 8 o'clock and till 8 o'clock at night. So you can come and go like anytime you want. You don't need to get the permission. You just come in and see your families. And then family can sit here inside as long as they want. They will, asking you a lot of questions. Sometimes they give the company to the patients, like helping patients settle down as well. Like some patient in ICU, they most likely developing delirium or the confusion as well. So family here is like quite helping the nurse for the patient oriented as well. What else? And then we did a handover around 1 o'clock. It's like a short, like 5 hours, and 1 o'clock in the afternoon staff will. So we have like 2 hours double staff time. So in that double staff time, we have like in service training, like they have all the education sections, so we can choose if we want to go. Because we have more staff on the ground. So if there's like heavy patients, we need to reposition. Sometimes we need 6 nurses to reposition 1 patient.
Correct.
Yeah. So we use that time to do like more heavy work as well.
Yeah. And that alone, takes your time, right, Selby? Because usually ICU, they have a lot of medication as well, like sometimes every 15-minute monitoring, isn't it? And so I think that's enough work. And so we're just very lucky in Australia, right? And also, yes, compared to the Philippines, also we can't, if it's a patient is in ICU, we can't really go and visit, right? It's restricted. So and then again, the family, they're there, they can help out as well. So that's the great thing about it. And
so you can see so you can see a lot of in my country, people are physically restrained, when people intubated, they physically restrained, the hand was tied. But in Australia, you barely can see they tie their patients' hands up. They use a chemical sedation as well as a reassurance and the family on the side as well. So this is big difference.
It's a big difference. Yeah, I can say that as well in my home country. And thank you for answering that, Selby, giving our nurses again insight, right? And so the other question, Selby, is there any difference in pay, right? Because I think a lot of the viewers, always wanted to hear about the pay, isn't it? And I hope you're getting paid well. But because it's a specialty ward, right? I just wanted to point out as well to the viewers out here, if you work for a nursing agency, like I did before, so whenever I work for emergency department or ICU, I get $10 extra per shift. I get per hour. Okay, so that's the difference if you work full-time, which Selby's gonna answer soon. But so is there any difference because you work in a specialty ward, Selby?
So let's do difference. Pretty much, let's probably no difference because I work in the public hospital. So it doesn't matter which department you work. You work in ED, ICU, in a ward or acute ward, or it's nothing different. So you get paid as your experience. So we have a grade 2, grade 3, and then year 1, year 2, year 3, year 4 until year 10. So it depends on your experience. The only difference is you want to work in this specialty ward like ICU, you need have a further study, just like I'm doing the
Correct.
postgrad. And they will offer like a TSP, we call TSP, which is like a specialty transition program. So for the nurses who want to join the specialty like a units, you can join the transition program first, and then further they will ask you to do a degree, a postgrad degree, to be a competent nurse.
Yeah.
As a different units, yes, but the pay is the same.
Yeah. Selby, look, I honestly think, the Australia should change it, isn't it? Like working in specialty ward, I hope they have extra, payment. But just for you nurses out there listening, yes, if you work for an agency, that's an extra payment per hour, because it's usually hard to get like a specialty nurse. Okay, and so makes sense if you work for an agency, right? You get that extra hours, because I did get that when I worked for an agency before. But Selby, given your experience, right, what advice can you give the nurses out there in terms of planning to work in ICU? And is there any tips on how to get the job, or are you able to help them answer, some interview questions that you've gone through?
Okay, so if you are planning to work in ICU but you do not have any Australian experience, like a hospital experience, I would suggest that you go to the ward first to more familiar about their system, their protocol, their procedures, how do they perform all that basic skills, and then you can progress further, join the TSP program, and then start from there. Yes, that's probably like a step by step, because if you apply ICU straight away, they won't take you. Definitely not.
True.
And and the interview question is basically the same as all the other nursing interview. Like you need to know the hospital's values, like the hospital values and the missions, like and they will ask you like a case study. For example, they give you a scenario and ask you how do you gonna deal with this problem. For example, the question I got, if your patient is now blood pressure is dropping and it's having a temperature 38.3, like what you gonna do? What do you think what it is? So it's use your critical thinking, follows DRS ABCD to answer those questions. You'll get a job straight away. It's not hard. It's like sharing your experience, overseas experience. How do you deal with the problems? They will sometimes ask you, do you have any challenging moments when you work in the hospital? Something like that. Sharing your experience and answer the case study questions.
Yeah. Wow. Thank you so much, Selby, for that. There you go, nurses. Some few tips there that Selby just said, right? And yes, Selby is correct. Given that I've worked for many different hospitals, I was just telling my friend yesterday. Sis, I don't know about me being a nurse. You name all the different, field of nursing. I've been there, okay? And different interview questions also with different hospitals. So just bear that in mind, okay? And yes, big tip there, Selby, is to know the hospital value. What are they offering? How many bed facility they're offering, and something specific to the experience that you had, before, because that's what they wanted to hear, right? And yes, dealing with conflicts mainly because of your character. They wanted to assess, are you going to be able to withstand any conflicts there? And and so the last question, Selby, we've come to an end, but I think don't leave yet, nurses, because stay tuned, because we're gonna ask Selby. And I just heard that you're studying, Selby. Is that right? What are you studying at the moment? I'm so proud of you.
The postgrad study, I think it's advanced, like a master degree in advanced nursing. So specialized in care. Yeah.
Excellent, Selby. And just wanted to tell the nurses out there as well, when Selby finished her master's, her pay award's gonna increase. Okay, and so yeah, so that's another thing to consider if you wanted to get paid more. You know, you study more, of course, like I did, right? And so your pay is gonna increase, but at the same time, you know, you're adding more value to your you being as a nurse and as a person as well, right? And that leads to our last question, Selby. Any long-term goal as a nurse?
So my goal at the moment is finish my degree. After my degree, I'll probably thinking about otherwise go to the manager pathway or the education
I love it.
pathway. So I haven't decided. See which one I prefer after I finish my study.
Yes. Savi, I love hearing that from you, honestly, because I know you're going to be a great leader and a nurse manager. That's very achievable, okay? And so if you need help, any mentoring, you know, I'm always here. You know, I'm just a message away. And I'm very, very happy to guide you. AURN Pathway is opening a registered training organization, and you could possibly have your own business alongside with AURN Pathway, right? Providing basic life support and first aid certificate. So very, very exciting journey for you, Selby. And I just wanted to leave all the nurses, thank you for listening, but let me guys leave you this quote, right? Very applicable and relevant to Selby. Vision is not enough, right? It must be combined with venture. It is not enough to stare up the steps, but we must step up the stairs by Vaclav Havel. Okay, and that's what exactly Selby is doing now in life. We always wanted to go further as much as we could, right? And I'm sure Selby's doing it for the kids. And at the same time, you know, the main goal is to obviously, you know, help a lot of nurses out there. And that's why we've had this interview today with the beautiful Selby. Again, Selby, thank you so much for your time. For those of you listening, comment down below if you have anything to ask Selby or me. We're more than happy to help you. And guys, thank you guys so much again. And please don't forget to subscribe, right? Tune in into our podcast regularly, because we're uploading every single month. Okay, because we wanted to add value to your nursing career. We wanted to empower you and serve you only here with nurse teacher Kristine, Australia. Subscribe in our YouTube channel, and we also on Spotify. Okay, and so Selby, thank you so much, and goodbye, listeners. See you guys next time.